Good morning. My name is Frank Deangelo. I'm the CEO of RushNet, and with me this morning is Dr. Rick Goulding, the chairman of the board of RushNet and GRPS. We've been invited here this morning to answer some investor questions. And before we get right into the questions, Rick, would you like to give us an opportunity to talk about RushNet and GRPS?
I'm just going to take a couple of minutes to go through some of the history here, how I got involved, how Mr. Deangelo got involved. But basically, I'm a physician, I'm a surgeon. I'm trained down at Jackson Memorial Hospital in Miami, and I've had a private practice for many, many years. I've since retired. Since I've retired from medicine, I think I've learned more medicine than I ever knew throughout my career. And that's pretty much going to be the genesis of the companies. Now, when I took over, both companies had zero assets and no money. So I was charged with a very formidable task, and that is basically to take both of these companies, give them assets, give them marketing, give them a direction, and to make them profitable, as that may be. So the goal of any company, of course, is to come up with, number one, they have to have viable products. Well, we've done that. Number two, they have to have a marketing plan of some sort. We have not made that announcement yet, but that is part of what we have created. Number three, we have to have absolutely stellar personnel. Well, I've made some blunders in the last couple of years with personnel, but that is what I'm reforming on my team, including Mr. Deangelo, are solid representatives of what we have now to offer. I will tell you this, that I probably have the worst job in the world. It makes absolutely no sense because I don't get paid. I had to put my money into this, and I probably have a lot less shares than many of the people that are going to listen to this. But I'm still here, and I'm here for a very good reason. We have a substantial thing to present to the public. We've created what I think are going to be very, very marketable products, which are going to be alternatives to a lot of the pharmaceuticals that are on the market. They're going to give doctors a particular advantage over the market, which we'll explain further and as we develop our marketing, as we explain our marketing to the public. In the meantime, I'm going to turn it over to Mr. Deangelo, who's our CEO of RushNet, to answer some of the questions and to introduce himself a little bit more formally. Thank you.
Thank you, Rick. As you can tell, and hopefully you can, the excitement that Rick is talking about RushNet and GRPS, and it's exactly that excitement is why I wanted to get on board. And when Rick asked me to become CEO of RushNet, I have no background in pharmaceuticals. I have no background in medicine. I have a background in business. And with my business expertise and helping Rick move the companies forward, hiring the people that we need, and believe me, we have some strong candidates that we are going to bring on board, and the announcement will come at a later date. This is why I wanted to become on board. And like Rick, it's my time is what I'm investing. And that's all, because there is no compensation. We're doing it for my time and to push this company the same way as I was able to do with my franchise groups and become incredibly successful. So with that, we ready to take some questions?
Let's do it.
All right, first question from our investors. When will we become a current on over-the-counter?
I don't think we could hear you back there.
When will we become current on OTC?
So GRPS, as of today or tomorrow, should be current. Now, all the filings have been made. We have our opinion letter done. Next, we'll work on RushNet.
Okay, question 2. Current status on the grant initiatives.
So the grants were something that I've taken on myself to fund. How do we bring money into this company so that we can purchase products, get them developed, purchase marketing plans, pay salaries, etc.? And there's a number of ways to do it. all of which I've endeavored to take upon myself. So one of the best ways to do this was to engage the services of a lobbyist, because he has identified basically targets of money out there that would be appropriate for our endeavors. To this date, we have not had any successful income from these endeavors, but they're still out there, and we anticipate that with this next stimulus package, we should do very, very well. All of the grants are still out there and still ready to be had. So there is not a day that I haven't talked to our lobbyists, but I've funded this. I strongly believe in it, and I think a lot's going to come out of that. With government money into the companies, that creates an incredible foundation for further development.
Rick, that brings up the question, why grants? We will be announcing at a future date some products that we believe will have a great benefit, not only to the public, but for all those who serve. And this is why we've asked the government for help, because we need to develop the products. It will be a great benefit, we believe, and this is why Rick brought on a lobbyist to try to take our case, our story, to see if we can't get involved and get the funding that we need to move our companies forward.
So the question is, why grants? Because it would create a volume of wealth within the companies from which we don't have to. I mean, obviously the companies would do very well and be able to purchase products, create them, distribute them a lot easier than having to go through what we're going to have to go through anyway, which is an IPO, and basically generating funds that way. Makes the IPO that much more valuable.
Question 3, are we still in collaboration with the anti-addiction patch?
Yes.
Actually, we probably need a little bit more on that. The anti-addiction patch is one of the reasons why we went for the grant, because it is so promising for anyone that is addicted to an opioid, any of the other narcotics. We believe that the product will help, and it will be a great benefit, not only, as I mentioned earlier, to the public, but to many of our veterans that are out there that could be dependent upon a narcotic, dependent upon an opioid. This is something that will help them get off of it and to move forward with their life. This is a product that we're going to feel really strongly about.
This is also a grant initiative, by the way, and it's a collaboration with Halberg Corporation, which is formerly Premier Biomedical. But it is a very interesting product, because it not only deals with, as you say, narcotic addiction, it deals with food addictions, it deals with cell phone addiction or video game addiction, anything that is repetitive behavior. That's a very neat product. Very, very safe, and it does, however, require a prescription from a physician.
Without giving much more away than that, we'll have that announcement at a future date as we're able to move forward.
Is graphene production still being progressed?
Yes, and that's part of one of the grant initiatives. That really requires a boatload of money to process, but graphene is definitely targeted, yes.
Are there any production trademarks yet?
We have trademarks on a number of our products that we've just been granted some of the trademarks for. There's another trademark that we are soliciting now, which hopefully we'll have in the next day or two.
Frank, do you have any input?
When I have an opportunity to jump in and support Dr. Goulding, I will. But he's doing a pretty good job right now.
Yeah, but, letting him not talk, this is the first time I've ever seen it.
Who are able academies? Says it's stated in 819 late filings as reason for delay of the 630 QR.
So there's a lot. When I first did this, I felt an obligation to tell the public everything that we were doing, even if it was failing. And there is some obligation to do that. The problem is some of the endeavor didn't happen for a number of different reasons, or didn't progress, or we couldn't progress because of certain laws and guidelines, FDA requirements, FDA changes, etc. And we haven't announced the Able Academics endeavor, but it is on the filings. So Able Academics is a chain of schools that we've acquired. And they're very, very unique schools, outstanding representation in the state of Florida. But they're specifically for kids with needs such as autism and autistic disorder needs. Through ABLE, it's such a provocative program that they're able to take kids, and their goal is to get them through high school. And these are all kids sometimes with severe afflictions. We're an excellent representative for them, and we've developed 3 products that will be announced shortly that will be an additive for all of these students. We anticipate putting up schools in every state in the country because there's a huge need. 1 out of 49 people are affected by autistic spectrum disorder. So our progress will be detailed very shortly in a press release.
What is a more definitive time frame to introduce a product to the market?
Frank, I'm going to let you handle this one, but basically, to introduce products to the market requires some funding. You've got to produce them, you've got to formulate them, you've got to store them, you have to market them. You're more adept at that than I am.
And Rick, and not to say before we actually produce a product and introduce a product, we want to make sure we've got these people behind it who believe in the product and the trials to support our product. And this is what we're doing as we're moving forward. We're in the process of putting some of the trials together, and I think some of the results will be very outstanding. We're very encouraged, but it takes time, and we certainly don't want to introduce anything unless we've got the public and we feel good about it. So yes, part of my job is to make sure as we move forward, get the facility, get the production, get the distribution all in line. But it's also part of my job to make sure that we're going to bring something to you all that you're going to want to stand behind, and we've got the folks who have used it and believe in it and are continuing to move forward with it.
Our first product, actually, though, is in production, and we'll be announcing that shortly. We do have, this is interesting because this is called Super Defense, and we haven't made this announcement yet, but we're doing it thusly. And in fact, this will help a little bit, but the initial results of this have been astounding. I'm a head and neck surgeon. Some of you may know that head and neck surgeons are also responsible for dealing with head and neck cancer, sore throats, tonsillectomies, problems with the throats, etc. I never had a product that would help a sore throat, which is part of the reasons we developed this. But that's basically what this all herbal product does. The initial tests, and we've done a lot of anecdotal testing, have been extremely strong. And we're going to allow some of our investors opportunity to sample this.
I know there's going to be disbelievers out there on an herbal product, but give us time. Let us show the results of the trials and the folks who have used it before you formulate your conclusion and look at our self-defense product that hopefully you'll stand behind and you'll believe as strongly in it as we do.
Will GRPS set up a standard leadership structure, such as CEO, CFO, and at least 3 independent directors?
I think we answered that a little earlier. We are in the process of putting an incredibly strong team together, And Dr. Goulding, as the chairman of the board, will be making the announcements at a future date on the company structure for GRPS and as RushNet. And I'm sure our investors will be quite happy on who our CFO will be and our other company directors.
Are you gonna fire me, Frank?
Unfortunately, Rick, your business card says chairman of the board. My business card says CEO. I don't think I can do that right now.
Okay. What is the GRPS plan to get out of sub-penny land?
You know, I never went into this to create some buzz about a penny stock or to make the stock price go up. My focus was to be on the products and to really make a difference as far as that is concerned. With a strong foundation, with good products, with good marketing, with a good staff, the rest of it should come. If it doesn't, then I don't understand the whole process. So I'm not going to hype anything. It's sub penny now. I think that with grant money coming in, with government money coming in, with a very successful initial IPO, I think you're going to see a lot of that reflected in the stock price.
Well, Rick, and this is one of the reasons why I got involved. As Rick said, he really feels strongly. And if we make some money along the way, we're all going to make it together. Us, the investor community, we're going to make it together. And we hope we're going to be able to acquire some grant money. It's a little early, and if and when it happens, we'll make that announcement. But we're encouraged. We believe in our products, and we hope that those who will help distribute the money will also see that. But money making it was secondary to what we believe and how we really believe that our products can help. And this is why, another reason why I was very happy to join Dr. Goulding.
Okay. All right, so before we move on to the RSHN questions, we will take a brief break. We'll be right back.
Thank you.